Hi, this is Sangeeta introducing you to the topic Irritable Bowel Syndrome. What is Irritable Bowel Syndrome? Let us learn together. Objectives. The main objective here is introduced to you to the topic Irritable Bowel Syndrome. Another objective is to learn about the management of this condition. Another objective yet again is to learn those skills that will help the person cope with the condition. What is Irritable Bowel Syndrome? This is commonly diagnosed and defined as abdominal pain or discomfort that has been experienced by a person for more than 3 months. There is a significant absence of organic pathology. Irritable bowel syndrome is a psychophysiological disorder which does not have purely a physiological cause, but also has a psychological cause. Only half of those who have such symptoms seek treatment. The rest seem to regard this as just any other problem. The psychophysiological studies confirm that people vary in their response to these symptoms that are experienced by the person. All these symptoms are nothing but gastrointestinal stimuli. That is the reason why the patient goes to a gastroenterologist, but never gets an idea that if the problem still persists, he should visit a psychologist. Those who seek help are those people who have a comorbid condition of depression or anxiety or a personality dysfunction. Treatment of the physical symptoms alone will not subside the disease. There is a psychological underlying factor that needs to be addressed, and only then will the condition be changed. There are cognitive behavior therapies and other psychological treatments that will reduce the preoccupation with the visceral sensitivity, and this has proved to be a lot more helpful in dealing with the condition. As mentioned earlier, irritable bowel syndrome is a gastrointestinal disorder that comes with a strong psychological component. Studies have established that 90% of the patients who have fallen victim to this kind of a syndrome have psychological bearings. This is a disorder of the colon, and this disorder causes abdominal pain, flatulence, diarrhea, bloating gas and constipation. All these are uncomfortable signs, but there is no permanent damage that is done to the colon. Unlike ulcerative colitis, which might later on land the patient into a serious condition like cancer, irritable bowel syndrome is a totally harmless condition, but definitely a condition that will bring about a lot of discomfiture in the person. In most of the cases, irritable bowel syndrome can be managed with dietary changes, lifestyle changes and stress management. What are the symptoms of irritable bowel syndrome? How will you know that you are suffering from such a condition called irritable bowel syndrome? Well, here are the symptoms that you may look at. Here too, the symptoms keep varying from one person to another. The most important symptoms that are experienced by the patients of irritable bowel syndrome is that of cramps or severe abdominal pain. There is a bloated feeling in the stomach, and there is mucus in the stool, there is constipation, there is a lot of flatulence and there is diarrhea. The intensity of these symptoms that are experienced by the patient vary from time to time. It is not necessary that the person who is suffering from irritable bowel syndrome experiences all these symptoms that are mentioned now. He may experience a few at one point in time and another later and another later, but this is a condition that is going to stay with him for a very long time to come, until and unless he takes the corrective measures at the correct time. There is also a chance that these symptoms do not at all respond to the medical treatment. Why? We have learnt that irritable bowel syndrome is a psychophysiological disorder. So, when you are addressing just the physiological aspect of the disease and not at all addressing the psychological aspect of the disease, there is no chance that this disorder is going to subside. So, when identification of the disorder as a psychophysiological one fails, the cure too is difficult to be attained, and irritable bowel syndrome remains a chronic case for quite a number of people. What are the causes of irritable bowel syndrome? We have learnt the various symptoms, we have talked that it is a psychophysiological disorder, but what is the cause of this disorder? The exact etiology of this disorder is unknown. There are the intestinal walls that are lined with muscle layers which contract and then relax in a rhythmic pattern when the food is moving in the stomach through the intestinal tract to the rectum. These contractions may be strong and last for longer duration than the normal. Food is then forced through the intestines more speedily, thereby causing diarrhea, bloating and flatulence. Just the opposite occurs in a few other cases. The passage of the food becomes slow and the stool becomes dry and hard. Therefore, abnormalities in the colon and the nervous system may play a major role in bringing together the discomfort when the intestinal wall is stretched owing to the flatulence that is formed. There are quite a number of other factors also that are involved in irritable bowel syndrome. There are a few other triggering factors also that might push a person into suffering from irritable bowel syndrome. What are they? First and foremost is the food. Yes, irritable bowel syndrome is a disorder that is concerning the colon, the digestive system and the nervous system. So, a lot depends on what you take in. The symptoms that a few people experience worsen when they consume a few foods. For example, milk is not suitable to all, alcohol is not suitable to all, chocolate when taken may bring about a lot of pain or flatulence or may trigger off constipation in a few people. There are a few fruits and vegetables when consumed will fill the person's abdomen with a lot of flatulence. They feel fully bloated. Apart from food, it is the hormones too that are responsible to push the person into suffering from irritable bowel syndrome. More number of women seem to report this kind of symptoms. It has been established that women are more susceptible to irritable bowel syndrome than men because of the hormonal changes that set in after a certain stage in the woman's life, and these changes are more predominant during the menstrual period. Though there are many people who may have the risk to develop irritable bowel syndrome, this syndrome generally targets women and the young and those people that have a strong family history also. When we are talking about family history, we are referring to the first degree relative, whether it is any of the parent or the sibling. If they are suffering from the condition, there is every chance that this person also may fall prey to irritable bowel syndrome. There are a lot of complications that might set in because of irritable bowel syndrome. What are they? The existence of this condition will in no way bring in the danger of getting cancer at a later point in time. This is very much unlike ulcerative colitis, wherein the person might end up getting cancer, but this is an absolutely safe disorder, but a pestering one at that. The mere existence of symptoms like constipation and diarrhea may only become the cause of getting hemorrhoids. There is nothing at all dangerous about this disease. There is only a meager chance that you might fall prey to hemorrhoids also, but not to cases like cancer. Because of the kind of problems this disorder brings in, you can rest assured that the quality of life has gone for a toss. Just imagine a person suffering from diarrhea. Will he be able to have a planned schedule for himself throughout the day? No, he does not know when he has to visit the washroom. A person who is suffering from constipation, a person who is suffering from flatulence, his entire existence becomes so very discomfitured and his state is totally inexplicable. As a result, what happens? The person will slowly give up on all his social activities. He will not go out because he is scared when the nature call will come next. He will not meet his friends because of the problem frequency with which he needs to expel gas. So, all these symptoms will slowly push the person from being a social person to a secluded one. What are the various tests that need to be conducted and how is the diagnosis made? A thorough physical checkup of the body and a focus on the complete medical history of the person will help in the diagnosis process. There are generally no physical signs that will help in the diagnosis of the condition. So, it is just the process of elimination that the expert has to follow and then boil down to saying that the person is diagnosed with irritable bowel syndrome. Researchers have developed the Rome criteria which helps in the diagnosis of irritable bowel syndrome. What is this Rome's criteria? As per this criteria, the person must have few symptoms and signs before the doctor actually terms it as irritable bowel syndrome. The main symptom of course is the discomfort and pain in the abdomen that lasts for at least 12 weeks. It is not necessary that the pain stays with you for all these 12 consecutive weeks, but in case you experience the pain for as long as 12 weeks, then your condition qualifies for being called as irritable bowel syndrome. He must have a minimum of 2 symptoms from the list that is talked about here. He should have observed a change in the consistency of the stool and the frequency of the visits. If you are straining to pass the stool, if you have a feeling that you are unable to empty your bowels completely, if there is abdominal distension or bloating, if you see any mucus in the stool, there are these 4 symptoms: mucus in the stool, abdominal distensing, experiencing strain while passing the stool, or a change in the stool consistency coupled with severe abdominal pain, then you may be qualified as being suffering from irritable bowel syndrome. There are a few other red flag signs also that may prompt the doctor to diagnose the condition as irritable bowel syndrome, and it can be done only after additional testing. Now, what are these red flag signs? There is bleeding caused in the rectum, there is weight loss, there is fever, there is abdominal pain caused due to non-delivery of the bowels. When these conditions also exist along with the conditions mentioned earlier, then one has to opt for further testing and diagnosis will be confirmed then. Treatment. The etiology of irritable bowel syndrome is not known. The treatment of the condition focuses mainly on tackling the symptoms, so the person can lead a normal life. The symptoms, when they are mild, they can be tackled easily. How can they be tackled? A keen observation has to be made on the habits of the person. Any changes in the diet need to be observed. So, what is triggering the disorder, what is triggering diarrhea, what is triggering constipation needs to be identified. When the right kind of dietary changes are made, when the right kind of lifestyle changes are made, it will help the person in tackling his condition to a great extent. But if the symptoms are severe, there is more to be done. You will have to eliminate all those foods that produce flatulence from your diet list completely. you will have to take anti-diarrheal medication and also increase the intake of fiber supplements. In case you are depressed because of the disorder, your doctor will perhaps contemplate on giving you antidepressant drugs also. The dosage, however, depends on the intensity of the symptoms and the combination of symptoms that you are exhibiting. Drinking fluids regularly, exercising regularly will help in countering the symptom of flatulence to a great extent. Medicines also need to be used with great caution. Irritable bowel syndrome, therefore, is a condition that comes in with multifactorial etiology. It involves a lot of gut reactivity and also motility and altered pain perception. One additional observation that the researchers have made in this disorder is that there are a lot of social and psychological factors that influence the digestive system, the digestive functioning, and then the illness behavior is enhanced or reduced. Psychological distress and major life events are frequently present in irritable bowel syndrome and responsible for some kind of outcomes. There has been a biopsychosocial model of irritable bowel syndrome proposed in as early as the 19th century. It opines that emotions play a major role in the way the gastrointestinal tract functions. The biopsychosocial approach also allows for the symptoms to be both determined and influenced by the psychological as well as social factors. The link between the psychosocial factors and the gastrointestinal function is through the brain-gut axis. The psychosocial factors influence every component of the biopsychosocial model. Early in life, genetics and environmental factors may affect one's psychosocial development and the development of gut dysfunction. Gut dysfunction and dysregulation of the brain-gut axis will definitely lead to irritable bowel syndrome. It has been found that the psychosocial factors have a lot of influence on the digestive function, on the symptom perception, on the illness behavior of a patient who is suffering from irritable bowel syndrome. And these health outcomes are definitely going to have an influence, a direct one, on the quality of life of the individual. There are few environmental factors that are associated with irritable bowel syndrome. And what are these environmental factors? Prenatal traumatic events, early stressful life events, upbringing environment, family function, family history, social learning, abuse history in childhood or during adult life. These environmental factors also are found to have an influence on the condition called irritable bowel syndrome. There are a few psychosocial stressors, and there has been a positive relationship established between these stressors and irritable bowel syndrome. Daily problems, maybe in the family or at workplace, major life events like divorce, separation, unemployment or death of a person may make the person stressed, and this stress has an effect on his digestive function. There are major social events like surviving a Holocaust, revolution, social changes, all these determine the onset of irritable bowel syndrome. What are the personality traits of a person who is suffering from irritable bowel syndrome? Personality is also considered to be a deciding factor in Personality is also considered to play a key role in the etiology of irritable bowel syndrome, and this will definitely help the person take a decision when he is trying to seek some kind of a help to tackle the condition. What are the health beliefs that people have about irritable bowel syndrome, and how can these people cope with the stress that the condition brings about? A lot of patients with irritable bowel syndrome believe that their chronic gut symptoms, indicate a serious illness or will lead to cancer. These patients also describe irritable bowel syndrome not only as symptoms, but mainly it affects their daily functions, it affects their thoughts, it affects their feelings and also relationships and behaviors. Patients have been found to report as if they have lost their freedom, as if they have lost their spontaneity, they have lost all their social contacts, as well as developed feelings of fearfulness, shame and embarrassment. All these could lead to changes in the behavior such as avoidance of activities and many adaptations in routine in an effort to gain control over their condition. Psychological assessment of the patients revealed that there are differences regarding how each one of them responded to their illness. The coping strategies that people adopted could be divided into two broad categories. First was problem focused coping and the second was emotion focused coping. In problem focused coping, it directly targeted the cause of stress. In emotion focused coping, it is used to handle negative emotions that are evoked by the situation. How can irritable bowel syndrome be managed? Psychotherapy. Will that help a person suffering from irritable bowel syndrome tackle the situation effectively? The brain gut interactions or the mind body interactions have been proposed for irritable bowel syndrome. Psychotherapy may help reduce the symptoms for a few patients. Cognitive behavior therapy also has been found to be extremely effective in helping people tackle their situation. Mental well-being is improved with hypnosis and cognitive behavior therapy. The psychologist can offer coping strategies to the patient which he can make use of to deal with the various complications that come as a result of his condition. Relaxation therapy is found to an ideal way in which a person can relieve his stress about the condition in which he is in. It has been proved that stress relief has a very positive effect on the way the severity of the disease can be perceived. Meditation, yoga, tai chi, exercises like walking and swimming also have found to be having a positive effect and bettering the quality of life of the patients suffering from irritable bowel syndrome. To conclude, irritable bowel syndrome is a psychophysiological disorder which brings in no danger at all with it, and patients who feel that this might lead into cancer can rest all their fears and adopt better dietary changes, better lifestyle tactics and take some psychological help because it is a psychophysiological disorder. Practicing relaxation techniques and leading a physically active life will definitely help them tackle the disorder in an effective manner.